shot. Okay, welcome to Deuk Spine Institute. Our patient comes here from Texas. She's a Texan. She has horrible back pain, horrible buttock pain on the right, and we've determined that she has a couple of issues. She has 3 painful discs. Shot. Num num. She has a torn piriformis muscle, and she is here because she wants to get rid of the pain. We're giving her some numbing medicine right now, but she doesn't want to have fusion. So turns out you can get rid of disc pain or spine pain with fusion surgery, but fusion surgery is invasive, and some people never fully recover. Shot. So she found out about the Deuk laser disc repair. Shot. And she decided to come to Florida and have this procedure done. Shot. Now I did a MRI review with her. Shot. And we determined that she had 3 discs AP that were causing her back pain. L3-S1, L4-5, L3-4, based on her MRI and the location of her back pain. And of course, statistically likelihood that, yeah, thanks. You can see the curvature to the spine. Now I'll tell you a few things about her. She's extremely knowledgeable in healthcare. She knows a lot about the spine and the body. And she is a avid runner, long distance. I used to run middle distance. She's a long distance runner. She's one of those people that you just say, wow, how do you do that? Because she runs about 30 miles when she runs. Okay, so serious running. Num num. We are in at L3-S1, the hardest disc to get to. I'm going to give her some more numbing medicine before I cut her skin. Now I'm going to give her a skin incision that's 7 millimeters at the right flank. I'm going to use that same incision to access L4-5 and L3-4 because we're fixing 3 discs. Any questions from the audience?
At this moment, no current questions.
You're off on WAG by about 8 degrees. How many degrees? Shot? Oh, Lord. Jordan, I'm not sure what you're doing. That's better. You're off by about 1 or 2 degrees there, but that's acceptable. Yeah, that's other way. We're making our incision. I've given her some numbing medicine. And as I was saying, she has 4 different causes to her lower back pain. She has 3 discs, shot, and she has the piriformis, so that's 4. The average number of back pain causes, you're way off on orbit. Way off. You can see a double bunny ear at the facets there. Shot. I think that's, I don't know, worse. Other way. Keep going. Oh man, the orbit seems to be getting worse. See it? Try going the other way, I guess. I don't know what you gotta do, but
What'd you get for antibiotics, guys?
anyway, why don't you work on that, Jordan, and try to get it sorted out. Shot. It's not too bad. Give me an AP. The lateral view could be better, but it's definitely better. I think it's better. Any questions?
At this moment, no current questions.
All right.
In the meantime, there's no current questions. Would you like to present of how there is 30 causes of back pain?
I think it's a wonderful idea. Thank you. All right. So George. Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that
We'll
reoccurs.
play that video again so you can watch the whole video, but right now we're ready to test these 3 discs to see if they were indeed the source of her pain. We call it a discogram, specifically an evocative discogram. Are you awake? This is all the blood we've lost so far, and probably all the blood we'll lose for the whole surgery.
Yes, she's awake.
Any pain? How long has she had back pain for? Lower back pain, 16 years. Are you in pain? No?
No.
How bad is that? You guys see her tense up? Her
Yes, we
back
do.
came up.
1 to 10.
How bad is that on a scale of 1 to 10?
What'd you say? Say it again. 10. 7?
What's the highest it went? Highest.
Give us a number.
What's the highest? What's the highest? Say what's
Sorry?
the highest?
What's the highest number? 1 to 10.
What's the highest
She
it
said
went?
7. She said 7.
All right, is that where you get pain?
Yes.
Okay. All right. How bad is that on a scale of 1 to 10? What's
Give
the
us a number.
highest?
What's the number? Say it again. 10? 10.
All right. Is that where she gets pain
So do
normally?
you normally get pain?
It's real simple. Yes or no? Is that where you normally get pain?
Yes.
Concordant.
Is it better now? How bad is that on a scale of 1 to 10? What's the highest it goes?
8.
Is that where you get pain?
Yes.
Good. You're going to go to sleep. When you wake up, all that pain will be gone. All right, great news. So we just learned from that test that 3 discs are causing her typical back pain she gets every day. L3-S1 was causing a 7 out of 10. Important to note, when I injected her, I didn't tell her, and you see her back arch up. I don't know if you guys could see that. We could see it here. It's easy. We're standing right here. You may have a hard time seeing it on the camera. But she tensed up, and I said, you know, how bad is that? Because I know she's having pain, and she told us it was a 7, and then it was a 10, and then it was an 8. Every one of those discs has tears. So we're going to go in with our dilator, and we're going to spread apart the muscle fibers so we can do her surgery. Now, we're not actually hurting her muscles like other surgeries that are invasive. We're only spreading apart the fibers. Like if you were to if you go to the parade and somebody gives you a pin to wear on your shirt, you take that pin, little safety pin thing, you slide it into your shirt. It's not making a hole in your shirt. It's simply spreading apart the fibers. And when you take the pin out later on, you're not going to have a hole in your shirt. You're going to have a normal shirt because, well, you didn't actually cut your shirt. You just spread apart the fibers. So it's the same thing with the dilator. It's like a giant safety pin going in. Everything under your skin has fibers. The skin does not, but everything below your skin is fibrous. Fibrous means it has like a cotton shirt, like cotton fibers. So you're not cutting anything under the skin with this surgery. We're just separating tissues. So there's really no trauma or damage to the tissues. And of course, there's no bleeding. We lose, on average, 5 drops of blood, maybe 10 drops of blood per surgery. Some people were on blood thinners, so they have more blood loss. Henry, this would be a great time to show the audience, why do herniated discs like this cause pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
All right, welcome back. You can see from our animation that when there's a tear and there's a herniation, that herniation causes a reaction in the tear called inflammation, and that inflammation is painful. And when you multiply it times 16 years, like this patient's had, that's 16 years of pain. It's like having a thorn stuck in your finger for 16 years that you can't get out. You know, your body can attack that thorn all day long. It's not going anywhere. It's going to stay there. If you have a piece of thorn, like a piece of wood in your finger, it could stay in there your whole life, cause all kinds of problems, and never go away. And that's pretty much what this herniated disc is. Instead of a piece of wood, you have a herniation. All right, Henry, I know we have a question.
Yes, we do. This question is coming from Big John on YouTube.
Oh my gosh, Big John. We haven't heard from Big John in what?
It's,
2 weeks?
Yeah, 2, maybe 3 weeks, give or take. But they said, hi, everyone. I have a question about hip/pelvic bone. Can an issue with an SI joint or facet joint can either cause the hip or pelvic bone to become not level, i.e. one side is higher or lower than the other side, causing one leg being longer or shorter than the other?
Well, Big John, that's a great question. Typically, I would say no, it cannot, but it can functionally do that. So if you're having SI pain or facet pain, it can cause you to walk funny, favoring one side, which basically would appear like one leg's longer than the other. So yes, it can from a muscle tightening up, walking bad standpoint, bad posture, bad gait. But you know, there's other causes for leg length discrepancy that you're describing. And one of the most common causes is people that have had surgery on their hip or knee. The surgeon sometimes will put an implant that's too short or too long, and it causes the one leg that had surgery to be too long or too short compared to the other leg. That is the most common reason we see leg length discrepancy at Deuk Spine, is bad orthopedic surgery, bad measuring, or settling, basically settling of the implants. Okay? That said, I'd be very interested to evaluate whoever this person is and see if they have sacroiliitis or if they have facet pain. It's pretty easy to do. Happy to do it. Any other questions?
No current questions, so we do have a comment coming from Kieran on YouTube
Kieran, of course. Yes, Kieran.
saying, "Good afternoon, Dr. Deuk. Hope you are doing well."
Thank you, Kieran. I had a chance to watch your video, Kieran. I believe you created it, if this is the right Kieran.
Last name starts with a K.
Well, ask Kieran, you know, he'll respond.
Okay.
But I watched a video created by Kieran, and I don't know if it's the same Kieran we're talking.
Yeah, he says yes. They replied
Yeah,
yes.
nice work. I think you did a great job. I think you've pointed out some important differences between the Deuk laser disc repair and the discectomy, but I think you've left out quite a bit, and that's okay. I'm not blaming you. I'm not criticizing you in any way. I'm just telling you. So, but you know, obviously you're not a surgeon, so sometimes not being a surgeon can limit what you're able to see in terms of differences. But I do appreciate it, and I think you'll be very excited to know we have some new animations coming on our new website, being launched August 30th this year, just next month, a month from today. And I hope you like them, and I hope you enjoy them and appreciate them. We're going to have those available as soon as we launch the site. Right, Henry?
Of course. I cannot wait for
Yeah.
that. And speaking of our videos, Big John just said, "Thank you, and I like your new informational videos." So.
Oh, good.
Yes.
I'm glad you do, John. Big John, yeah, I was just saying the site's going to be launched, the new one. And, you know, we're actually launching two sites. The first one is called Deuk Spine Institute. It's a makeover of our current Deuk Spine Institute site, and it's going to be dramatically different. I've had a team of people working on it for almost 2 years. The first guy stole our money and never produced anything. It was unfortunate. Ran off with a lot of money, a lot of money. I'm embarrassed to say how much. But it was, let's just say, what is it when you're over $100,000? What is it? Huh? No, I'm mad, yeah, but what do you call it? Like triple digits or something like that? Or five figures? 6 figures.
6 figures, yeah.
So, yeah, the number is in the 6 figures. Stole our money, stole my money, and left us like literally high and dry. So we're suing him. He's a crook. He actually ripped off other people too, but I didn't know that when I hired him. He's been sued by apparently many of his clients. Shame on me for not doing my due diligence better. I take full responsibility. Long story short, I digress, and we're almost done with this disc. But, I couldn't hear you. Yeah, he was, I went to YouTube and I looked for the best web developers. You know, remember, I'm just a neurosurgeon, dude. I'm trying to figure all this out, right, as a business owner. And these are not easy issues, right? They're really complicated. Like figuring out who can actually build a website properly and who's not going to scam you. There's so many scammers out there. Like web design and development is one of the most common scamming things out there. So I thought I went with a reputable company, and of course there's a lot of lying that goes on to bolster their reputation. Anyway, long story short, putting that in the past, we have an incredible website that's about to be launched, and what I was going to tell you is that we have a second website called Deuk Joint Institute for our new Deuk Joint company, which is the sister company of Deuk Spine, but focused on knees, hips, and shoulders. And so Deuk Joint will be launched about 3 months after Deuk Spine, Deuk Joint Institute website. So look for those. We have these incredible animations. You've seen a few of them. We've been highlighting them on our surgeries, live streams, but we have more, and I think you're all going to really like them, okay? They're highly educational, informative. So Karen, keep your eyes open, but thank you for sharing your video. All right, let's go to a lateral view. We finished one disc. We're going to move on to disc number 2. Again, our patient travels from Texas, and she's a long distance runner, has been competitive. She does the ultra marathons. She has not been able to run in a long time because of her back, and I'm excited to get her feeling better. And I told you all that most patients that come here have more than one cause of back pain. It's very important to remember that. The truth is 8% have one cause, and 92% have more than one cause. So the vast majority, average, have 4 causes. 4 causes of back pain. All right, let's see what we got here. You can feel the herniation. Go ahead, put it on. Oh. Shot? Is that it? Shot? Uh-huh. Got lucky. So the average patient presents with 4 distinct causes of back pain. If we fix one, they're still going to have 3. Oh, man. It's just hard with this fluoro being where the fluoro is. It's like right here. I can't. I did want to say that I was surprised to find, on looking at our data, that around 20% of our patients had 7 or more causes of back pain. 7. I've even seen people with 15 causes of back pain, which is a lot. That's facets on both sides and SI, piriformis, disc. So the message here, folks, is back pain can be cured, but you have to identify all the sources. You can't just choose 1 or 2, fix those, and expect the patient's pain to be gone. It's not. And that's what most doctors do. Most doctors don't treat the patient, they treat the MRI. Well, I got news for you. The MRI never shows where back pain comes from, okay? You can never just look at an MRI and say, oh, I know where their pain's coming from, unless, of course, they have a tumor or a fracture. But even then, fractures are often healed, you know, by the time somebody gets an MRI, and it's not the fracture causing their pain. So the God's honest truth, and you guys got to know this, MRIs never tell the doctor where pain comes from, never. So chronic back pain, you have to use the physical exam. You have to examine the patient. You have to see where there's pain, where there's tenderness. That's the secret. And, you know, I was told as a medical student how important the physical exam was. And of course, you know, being a medical student, you're kind of green behind the ears, and we believe that the physical exam was not important and that everything could be figured out based on diagnostic tests, MRIs, CAT scans, x-rays, blood work. So, and it wasn't me that just believed this, like a lot of us believed it. We all thought the physical exam was going the way of the dodo bird, extinct, and how wrong I was. Like with brain surgery, it's very important to do the physical exam as well, as a neurosurgeon. You want to figure out what cranial nerves are affected. You see, MRIs are not functional. MRIs are structural. Now there is functional MRIs, what they call functional MRIs, but they're very limited in their functionality. All right, so really the best way to figure out the function of a patient's body and how it's performing is a physical exam. And that's something that you learn in residency and medical school, but it is so absolutely true. I'm a big believer in that now. I didn't really believe it before, but I'm a big believer now. And one of the worst things that spine surgeons do, they do two things. Spine doctors, doctors that treat pain, do two things. Number one, they assume that pain is not curable. And that's their biggest flaw. They don't realize pain is now curable. Curable. Number two, they make a lot of assumptions based on hearsay, what they've been told. Okay? They don't actually figure things out themselves, like a true scientist would. They just base their opinions and prejudices on past information, okay? What they've been taught from before. Well, here's the problem with that. If you just go around life believing what you've been told before, you're never going to be open-minded to change and new things, new ideas. And the thing about medicine that's 100% certain is that it's a changing field. Always changing. Things are changing. People are discovering new things, new technologies, new ideas. Thank God, right? I mean, thank God we discovered antibiotics and now we can cure infections, whereas people just died from them in the past, right? Thank God we discovered what's causing strokes and how to stop it. So, as long as they follow the medical advice. So the reality is that medicine changes, and the doctors that have these biases based on, 50-year-old ideology, and they're dogmatic in their beliefs, they're just hurting their patients, because the patients need to know and need to be treated with the latest and best treatments that work the best. And a doctor who comes in and just says, nothing has really changed, we're just going to keep doing epidurals, we're just going to keep giving you pain pills, we're just going to send you to physical therapy, even though it doesn't work, we're going to just keep doing the same things we've been doing for the last 50 years. Laminectomies, discectomy, fusion. Those treatments are not the best treatment for the patient. And so the important things your pain doctor and your spine doctor are doing that are hurting you is they believe that pain does not have a source, and they believe that there's no cure for pain. And that's wrong. That has to change. All right? And you guys have to demand that it changes from your doctor. I've gone out and given talks, and they just don't listen, They'll listen and they'll clap and they'll say, great job. But they don't change the way they practice based on this new information. And that's why it's hurting patients, because the doctors are not incorporating this new ideology, new technology into how they treat people. And you guys have to demand that they do. And that's why we broadcast our surgeries, because we want you guys to know there is a way to fix pain permanently. And even though doctors around the world aren't doing it, we're doing it right here at Deuk Spine. So you can still come here. Big John knows. How are we doing on questions?
Yes, we have a question coming from Essential Advantages once more on YouTube.
Sure.
Asking, do you start all disc laser surgeries with a patient numbed first to see if they feel pain and then fully sedate them after?
I got to think about that one. All of our patients' surgery, Deuk laser disc repair, lower back, start with the patient slightly sedated and just comfortable on the bed, and then I put some numbing medicine in the skin and then stick the needle in and get down to the herniation. That's true of all these cases, all right? But I need the patient, can you go lateral, please? I need the patient awake so that they can help me as I put the needle in. Because as I'm putting the needle in, I'm using the x-ray, but the x-ray cannot see the nerves. That's one thing x-rays can't do. They can't see nerves. X-rays can only see bones. And we can guess where the nerves are supposed to be, and I kind of know where they're supposed to be, but having the patient awake and helping me gives me an extra level of information that I want and need, and it's at a low cost. The low cost is the patient's awake, right? And so what I mean by low cost is it's really easy to do, just having the patient a little bit awake in the beginning of the surgery. So I don't know if that answers your question.
No current questions, so we do have a comment, a few comments coming from Mary on Facebook.
Hi, Mary.
Saying, good afternoon, Doc.
Afternoon.
Good to be here. Physical exam is my top priority right now. I am so frustrated. It makes me so mad.
Yeah. I don't know, Mary, are you a patient or a provider? Either way, welcome to our live stream, and I'm glad you can appreciate the value of the physical exam shot. Yabba dabba doo. Shot. And that's really not a very pretty picture. I need a new glove. Jordan, I wish I could have a better view. I mean, there's no way that's right, you know? I'm going to put my glove on the ground. I touched the fluoro, you know. I've never had this fluoro so far south like this. Can you put pressure there, please? You see what's happening? It's called bleeding, and it's going to keep bleeding as long as you don't put pressure. All right, let's move on. Yeah, it's okay. I can accept human fuck up once in a while. You guys do a good job 95% of the time. Move, please. AP. What do you think's wrong with that picture, Jordan? If you had to guess. Good. So can you fix it? There you go. All right, back to a lateral. Now remember where the AP is, right? I promise you, if you had to come this far to get an AP like this, and you're going to have to go a lot more than just a true lateral to get a lateral. I'd say the other way, but go ahead. Shot. That's just so far off. Release. Release the arm. Shot. All right, that's good. Now wag it in. Shot. It's not too bad. Work on it while I try to get a better access to 5-1. Shot. Shot. Is that it? Yes, sir. All right, you're off on orbit just a little bit. Shot. I think that's better. Actually, let's just leave it. You're about a degree off on orbit. So let's just leave it and let's go to an AP. Any questions?
Yes, we have a question coming from Essential Advantages once more on YouTube asking, is that all for lower surgeries then? What about if it is cervical?
I honestly don't remember the question. Maybe you can repeat it.
Yeah, from their follow-up question, they asked, do you start all disc laser surgeries with patients first to see if they feel pain, then sedate them
right.
after? And
I see. Yeah,
yeah.
okay, sorry. So to see if they feel pain, the answer is yes, we do a discogram because the patient's already awake. And I want that information. I want to know if this surgery is going to help them, okay? So the discogram gives me that information. For cervical spine, on the other hand, the patient is completely asleep. I got too much light in my eyes, okay? You guys are supposed to be turning that stuff off, moving it without me having to stop and tell you. This light is shining right in my eye. All right. So for cervical, the patient is completely asleep to begin with. We don't do an evocative discogram. We're not going to see if the patient has neck pain with an injection. So no, we don't do it for cervical. We do it for lumbar. We do it for thoracic disc repairs. That's it. Shot. All right, take that, take it out. Uh-huh. All right, that should be good. Her spine is so twisted, it makes the surgery much harder for me to do because it's so twisted. It makes it very, yeah, that looks good. It makes it very difficult to get the angles right. Makes it more risky for the patient. All right, any questions?
No current questions, so we do have a comment coming from Mary once more on YouTube.
Sure.
Saying, I'm here now, Doc. I'm supposed to come there 3 years ago. I had my first car accident in September of 23. Now I have a lawsuit because I'm really bad. I'm in New York. Expenses, travel seems impossible to me. Thank you for your info. I need a cervical and a few back surgeries, including thoracic.
Well, we can definitely help you. We're probably the only place in the world that can handle that for you. So you're going to need to get here. I don't think we're going to open a Deuk Spine in New York for a few years. We just can't afford it. These are expensive facilities to open and run. So we're going to be in Florida for a while. We're a small company, but we offer big, big results for people who are in pain. The truth is, the world, we are literally 50 years ahead of the rest of the world when it comes to treating pain. At least 50 years and counting. I've said that before. So true. I look at the rest of the doctors around the world that are treating people's spines. I look at what they're doing, why they're doing it, how their results are. Are they good? Are they bad? What's the success rate at fixing people? And it truth is their techniques are old and flawed. They're much better techniques, and their indications for treatment are wrong, completely wrong. And they're doing lots of treatments that don't work. They're doing them because, well, that's what they were taught to do, right? Everybody else is doing the same thing. It's cultural. It really has a lot to do with culture, education. These aren't necessarily bad people, bad doctors. They're just, unfortunately, not trained properly at their training institutions. And they're doing old types of treatments that don't work for the patient. They work for the doctor, but not the patient. You know? Doctors have no problem doing treatments that they can make money off of. And by the way, the problem is that a lot of these bad treatments are driven by the insurance companies. The insurance companies want patients to have treatments that don't work because the word gets out that the treatment doesn't work or it's dangerous, and people will refuse it, reject it. They won't get it done. It saves the insurance company a lot of money when people refuse treatment. That's the best way to save money as an insurance company and be more profitable, is to basically have the patients not want the treatment the doctor recommends. So they're happy to cover treatments like fusion, laminectomy, discectomy that don't work well, that are painful, that have high complication rates, because maybe 50% of the patients will get a laminectomy that are recommended. The other 50% won't. Maybe 25% of patients recommended for discectomy will get it, but the other 75% won't. They'll refuse it. And with fusion, only 1 in 10 patients will do the fusion they're told to do. So the insurance company love these procedures because people won't get them done. These insurance companies are not stupid, and denying treatments is bad publicity. They don't want to do that. So what they want are treatments available that they cover that don't work, because everybody knows they don't work, so nobody's going to do it. But then they can say, yeah, we offer that treatment, we cover it, but it doesn't work, but that's not our fault it doesn't work, we cover it. It's the stupidest thing I've ever seen. And it took me a long time to figure out what was going on. But I've had meetings with these insurance companies. We've presented our results of our treatment that are far better than any other treatment, and talk about safety, talk about the effectiveness of these treatments. They don't care. They say we have no way to gauge quality, you know, but we just cover fusion. That's it. It's quite remarkable, folks, quite remarkable. That said, we just got another payment, which is good for one of our patients that had it. So it's not that it never gets covered, it does. And for the people that want it covered, there's always the option of fighting your insurance company, which is what I recommend. Because insurance companies, as I said, they don't like the bad publicity. So if you're willing to fight them, you're willing to put on your gloves and go out there and fight, chances are they're going to just pay the bill, shut you up. They hate people that call them and bother them. They don't like that, right? They don't mind you calling the doctor's office and bothering the doctor's office, but they do mind you calling them and wasting their time. And it's quite funny because when my staff call the insurance companies to talk about a bill and get it paid for a patient, they will literally say, please hold on, and they'll put my billing girls on hold for 2 hours. 2 hours. Sometimes hour and a half, sometimes 2 hours. And they will literally sit there for 2 hours waiting for somebody from the insurance company. Well, the insurance company doesn't do that to the patients. They only do it to the doctor's office. Because they don't care if the doctor's office hangs up. They want you to hang up. They want you to give up. They don't want the patients to be waiting for 2 hours, because the patients will go to the senators and congressmen and go to the newspapers. Insurance companies know that, so they never make the patients wait 2 hours to talk to a representative about their claim. But they make us wait 2 hours, 3 hours. They do it to the hospitals, they do it to our doctor's offices, all doctor's offices, by the way, which is why doctors lose around 30% of their money owed to them from the insurance company is because the insurance company denies the payment. They don't pay it when we send the bill. And then you call them to find out why aren't you paying, and they make you wait for 2-3 hours at a time. And then they don't have an answer until you to call back the next day. It's crazy what's happening. It's destroying healthcare, destroying medicine, because doctors can't afford it, to have so many staff on the phone waiting, and the insurance comes for like $80 a time. All right, we're going to do our piriformis release next. Henry, you want to end and come back?
Yes, sir.